Pediatric stroke is a rare condition affecting approximately 1 in every 4,000 newborns and 2,000 older children annually, according to Johns Hopkins Medicine. It is classified as a disorder of the blood vessels of the brain, which can be ischemic due to lack of blood flow or hemorrhagic, caused by bleeding in the brain. Damage to the brain's blood vessels results in loss of blood supply and injury to the surrounding brain tissue. Treatments and long-term outcomes vary depending on the type of stroke. Without immediate and appropriate treatment, stroke can be fatal, being one of the leading causes of death in children. Additionally, it can cause neurological disability, with the risk of permanent cognitive and motor impairment. Because of this, the two most important questions that arise are: how to identify early a pediatric stroke, and what to do if you identify a pediatric stroke. We will answer these questions throughout the video, so subscribe to the channel and let's get to the video. Firstly, it is important to know that strokes in children usually begin suddenly. Symptoms may include, but are not limited to, the following. Number 6. Weakness or numbness on one side of the body. Weakness or numbness on one side of the body is a significant symptom that may occur in pediatric stroke, indicating a possible interruption in blood flow to a specific region of the child's brain. This manifestation may be noticed by parents or caregivers and should be promptly reported to a healthcare professional for immediate evaluation and intervention. Weakness or numbness may affect one arm, leg, or both sides of the body and is an important warning sign that should not be ignored. Identifying this symptom early is crucial to initiating appropriate treatment as soon as possible, with the goal of minimizing the consequences of stroke and promoting neurological recovery in the affected child. Additionally, it is essential to understand that weakness or numbness on one side of the body may vary in intensity and duration, being intermittent or persistent. This variation may depend on the extent and location of the brain damage caused by pediatric stroke. Therefore, parents and caregivers should be alert to any changes in the child's health status and seek immediate medical assistance if they notice symptoms suggestive of weakness or numbness on one side of the body. Early diagnosis and proper treatment are crucial to ensuring the best chances of recovery and minimizing the impact of pediatric stroke on the child's life. Number 5. Slurred speech or difficulty with language. Slurred speech or difficulty with language is a symptom that may arise in pediatric stroke due to interference with the proper functioning of the brain areas responsible for verbal communication. This manifestation may present as difficulty articulating words, forming coherent sentences, or understanding spoken language. It is important for parents, caregivers, and healthcare professionals to be alert to any changes in the child's speech or language, as this may be an early sign of stroke. When recognizing these symptoms, it is crucial to seek immediate medical evaluation to initiate appropriate treatment and maximize the chances of recovery of speech and language function in the affected child. Additionally, it is essential to understand that slurred speech or difficulty with language may vary in severity and persistence, depending on the extent and location of the brain damage caused by pediatric stroke. Some children may experience temporary difficulties, while others may face more lasting challenges that require specialized therapeutic interventions. Therefore, a multidisciplinary approach involving speech therapists and other healthcare professionals is essential to provide the best possible support to the child and facilitate their rehabilitation after a pediatric stroke. Number 4. Difficulty balancing or walking. Difficulty balancing or walking is a concerning symptom that may arise in the context of pediatric stroke, reflecting possible neurological dysfunctions that interfere with the child's motor coordination. This manifestation may present as instability when walking, loss of balance, frequent stumbling, or difficulty performing coordinated movements. It is essential for parents, caregivers, and healthcare professionals to be alert to any changes in the child's walking pattern, as this may indicate a serious neurological impairment that requires immediate medical evaluation and intervention. When identifying difficulties balancing or walking, it is crucial to seek medical assistance promptly to initiate appropriate treatment and minimize the impacts of pediatric stroke on the child's motor function. Early intervention can help restore the child's mobility and independence, as well as facilitate their participation in daily activities and promote their long-term quality of life. A multidisciplinary approach involving physiotherapists, occupational therapists, and other healthcare professionals is essential to provide comprehensive and personalized support to the child during their rehabilitation after a pediatric stroke. Number 3. Vision problems, such as double vision or loss of vision. Vision problems, such as double vision or loss of vision, are concerning symptoms that may arise in the context of pediatric stroke, indicating potential neurological impairments in children. Double vision, also known as diplopia, occurs when a child perceives two images of a single object, while loss of vision may involve decreased visual acuity in one or both eyes. These visual manifestations may be alarming to parents and caregivers and should be promptly reported to a healthcare professional for appropriate evaluation and treatment. It is crucial to understand that vision problems may be an early and important sign of pediatric stroke, requiring a rapid and effective medical response to minimize brain damage and improve the chances of recovery for young patients. Identifying and promptly addressing these visual symptoms is essential to ensure that the child receives the necessary assistance to restore their visual function and prevent additional complications from stroke. A comprehensive ophthalmological assessment and neurological investigation are essential to determine the underlying cause of vision problems and develop a personalized treatment plan for the affected child. Before we move on to the next tip, if you want to know more about how to prevent stroke, access the link I left in the first pinned comment, where I will leave you with exclusive material. Access it now, while the material is still available. Now, back to the video. Number 2. Sudden lethargy or drowsiness. Sudden lethargy or drowsiness is an alarming symptom in the context of pediatric stroke, indicating possible neurological dysfunction in children. Promptly recognizing these signs is crucial for immediate and appropriate medical intervention, aiming to minimize brain damage and improve recovery prospects for young patients. Identifying and addressing these symptoms quickly can be crucial to mitigating adverse effects and promoting effective rehabilitation in children affected by pediatric stroke, underscoring the importance of vigilance and rapid response to changes in alertness in young patients. Number 1. Seizure. Seizure, characterized by rhythmic unusual movements on one or both sides of the body, is a critical symptom to be observed in the context of pediatric stroke, indicating potential neurological complications in children. Promptly identifying this manifestation is essential for immediate and adequate medical intervention, aiming to minimize brain damage and improve recovery prospects for young patients. Recognizing and promptly addressing these symptoms can be crucial to mitigating adverse effects and promoting effective rehabilitation in children affected by pediatric stroke, highlighting the importance of vigilance and rapid response to seizures in young patients. Now, answering the second question, about what to do in case of pediatric stroke. It is always important to remember, if you suspect that your child is having a stroke, you need to urgently call the emergency service in your country immediately. In the United States, this number is 911. Do not hesitate. When in doubt, call. Every minute will make a difference so that your child has more chances of preserving their life, as well as minimizing the damage possible. There are other important points to discuss on this subject, such as, what are the risk factors for pediatric stroke? How is the diagnosis of pediatric stroke made? How does pediatric stroke treatment work? Or what care do you need to take with your child in the recovery from pediatric stroke? But if you want me to continue bringing more information on this topic, leave a comment for me to know if I should make more videos on this subject. And, remembering that if you want to know more about how to prevent stroke, I will leave you with exclusive material. To access, just click now on the link I left in the first pinned comment. Access now, while the material is still available. In addition, thank you very much for watching this video so far. Until next time.